Hi guys, my name's Katie of Katie's Fitness. I'm a women's health personal trainer specialising in weight loss and toning, pre and postnatal exercise, abdominal separation healing and pelvic floor rehabilitation. And I'm here today to talk to you about diastasis recti or abdominal separation. Now, abdominal separation is a condition that occurs mostly in pregnancy, although guys can get it too. It's where the six-pack muscles or your rectus abdominis peel apart. If you think about it, when you're pregnant, the six-pack comes out and out and out. And for most people, most women, it will get to the point where it can't stretch anymore. And so it just separates out and it comes round to the side of the bump. And postnatally, you've had your baby. For a lot of women, that bump, that six-pack muscle will ease back together again. But for a few women, it won't. So I'm here to tell you how to check to see if that has happened to you. Wait until you've had your 6-week check, because generally speaking, if it was going to go back together again, it would have done by your 6-week check. I do suggest that you get it properly formally diagnosed either by your GP or a women's health physio or a women's health personal trainer. But you can check yourself if you suspect all is not right. So what you'll need to do is you'll need to lie down. Don't just lie. You need to lower yourself down carefully so as to protect the area. So you put your hands down onto the side, shuffle your weight down, and then roll carefully onto your back. My knees are in the air, my feet is flat on the floor. Now you'll need to see my tummy for this bit, so I'll get my belly out. So generally speaking, a diastasis is measured in fingers width. So when you're checking, you are checking to see how many fingers widths your six-pack is. Now, anything less than 2 fingers is not considered a diastasis. Anything 2 fingers width or more is considered a diastasis. So you're basically seeing how many fingers widths you are. So what you do is you start by you always start by measuring above, and then you measure on the navel, and then, if I can get there, below the navel. So you start by putting your fingers east-west on your stomach, just above your navel, and then you just perform the tiniest of sit-ups, bringing your head and shoulder blades off the mat. So you push your fingers in and then sit up, and you're basically feeling the walls of your abdominal raphe, the sides of your six-pack, and then down, and you move down on the tummy button. You're pushing in again, and then you just lift your head and shoulder blades up, and you're just feeling to see if your six-pack muscles close around your fingers, or if you can fit in 3 fingers or maybe 4 fingers. And then you come back down again, and then again. You push your fingers in, you lift your head and shoulder blades up, and you're just there feeling across, just to see if you can feel the sides, the walls of your six-pack. So as I said, gaps are measured in fingers width. So when you feel the walls of your abdominal raphe, there should be 2 ridges in there with a slight depression in the middle. You're looking for 2 fingers width. Anything 2 fingers width or less, although there is separation there, it's not considered serious enough, and it's not a full diastasis. It's just kind of how human abs work. If it's 2 fingers width or more, so in other words, if it doesn't close round your fingers, or you can't feel the walls touching either sides of your fingers, that's when you need to seek advice. And certainly if you can fit 3 fingers or 4 fingers in, then you do need to speak to somebody about it. The other thing I come across is I will put my fingers in gently into a woman's tummy, and there's literally nothing there. I'm kind of rooting around. It's not necessarily that there's a gap. It's often that the walls of the abdominal raphe are indistinct. There could well be not a gap there at all, but it's just really, really hard to tell because the muscle tone is very loose. I often find it in vegetarians or in vegans who don't get enough protein in your diets, but I've come across it in plenty of carnivores, so it's not exclusively them. The point is, if you put your fingers in your own tummy and you can't really feel anything, you need to get some proper advice on that. The other thing I've come across is women who have been left postnatally with a really large bulgy tummy, and they think that's a diastasis. It can be that women have abdominal, so the six-pack muscles are separated and they have a real baby pooch, But I've also come across plenty of women whose six-pack muscles are perfectly aligned, and yet they still have a pooch, and there can be a number of reasons for that. But make sure you check properly or get it checked properly. Don't assume that because you still have a really big baby bulge months postnatally that it's because you have a diastasis. There could be other stuff going on there. So in summary, if you lie on your back, bring your head and shoulder blades up, put your fingers into your tummy and have a little wriggle. If there's a gap of 2 fingers width or less, you're okay. You're safe to do any formal exercise. You're safe to do impact. If you put your fingers in and it's more than 2 fingers width, so you're getting it's either not gripping on 2 or you're getting 3 or 4 or more, then you need to seek proper medical advice.